Fellow Ghanaians, good morning. So, fellow Ghanaians, every now and then, we get treated to stories that break the hearts and the same stories that expose the very depravity of our nation. And sometimes they are the same story. That is what the latest posting data from the Ghana Health Service is. It is one of those mirrors that is always held before us that forces us to confront who we have become, what we value, and whether the word nation would still means anything beyond the ink on our passports. Fellow Ghanaians, because when a country posts 463 newly trained medical officers to its hospitals and clinics, but only 158 show up, and the remaining 305 vanish into thin air as if the oath they swore was merely a formality, then this is not a statistic problem. It is not some paperwork issue. It is not a delay in reporting. It is a revelation that something fundamental in our system, in our moral fabric, in our governance, has collapsed beyond any denial. Fellow Ghanaians, how does a whole region, and listen, not a district, not some sub-district, but an entire region receive 0 doctors after postings? How does Upper West region, with more than 1 million people, receive a posting of 32 doctors and not even one shows up? How do we normalize this as if this is some administrative hiccup and not a national tragedy? In the Northeast region, 19 doctors posted, none reported. In OT, 21 posted, 1 reported. Western North, 31 posted, 2 reported. These are not absentee figures. These are distress signals from communities that are continuously left to fend themselves. Communities already struggling with poverty, distance, and infrastructural decay. What kind of country operates like this, where a pregnant woman must first pray before she pushes, not because she's religious, but because there may be no doctor in the entire district to help her if things go wrong? Where a child in Wa or Nalerigu develops a fever in the middle of the night, and the family must negotiate with fate, not medicine. Where snake bites, road traffic accidents, malaria complications, and diabetic crisis now all of a sudden becomes a death sentence because the people with the skills to intervene simply did not show up. And yet, fellow Ghanaians, in all of this, Greater Accra alone, 16 out of the 20 posted doctors have already reported. In Ashanti region, 25 out of 33 reported. In Eastern region, 23 out of 36. The pattern is not random. You follow it. It is not a story of a nation that has created 2 worlds. It is one where healthcare is accessible and another where survival is a matter of geography, a matter of lack of divine intervention. We do not have to pretend that these doctors are inherently wicked or that their hearts are made of stone. They are responding to a system that has taught them repeatedly that the safest way to build a career is to cling to Accra and Kumasi, where there is equipment that works, where there is accommodation that does not leak and where security can be assured, where they can pursue further training, where the health facilities are not graveyards that are waiting to happen. It is a policy that sends them into neglected regions with no tools, no incentives, and no hope. It is a deployment system that is punishment that has been disguised as national service. But understanding is not the same as excuse, because while we understand the reasons the doctors may not be showing up, we cannot ignore the consequences. A society where the accident victim in Kaswa has a fighting chance while the accident victim in Wad dies in the back of a tricycle because there was no doctor on duty is not a sane society. We cannot build a country where the location of a child's mother determines their access to life-saving medical treatment and healthcare. We cannot continue pretending that Ghana is one nation when our policies treat some citizens as disposable, invisible, or even unworthy. I have heard some argue that the health minister's ultimatum to these doctors that they must report within 1 week or face sanctions or fix the situation. My fellow Ghanaians, threatening people into caring has never built a nation. It has never worked in education, has never worked in policing, and it will never work in healthcare either. You cannot send doctors into rural postings where electricity is unreliable, accommodation is non-existent, hospitals have broken down, machines and security is uncertain, and then expect them to show up with joy merely because an ultimatum was issued. We must be very frank with ourselves. Our health workforce deployment system is collapsing. And if we do not redesign it from the very scratch, people will continue dying quietly, or we hold press conferences right here in Accra. We need incentives, real incentives, not cosmetic. We need accommodation that is decent, not some dilapidated place. We need hospitals that are equipped, not glorified consulting rooms. And fellow Ghanaians, we need to guarantee postgraduate training for rural service, not punish doctors for accepting difficult postings. We need to stop pretending that patriotism can replace policy. Fellow Ghanaians, a nation reveals its own values, not by how it treats the elite, but how it treats its most vulnerable. And right now, the message is loud and clear. If you live in certain parts of Ghana, your life is worth less. This is not hyperbole. This is the truth. That the posting data is screaming right into our faces. So for how long must that woman in Japa wait on the roadside for transport to hospital with no doctor? How many newborns in Bunkurugu must suffocate because the only facility in the area cannot find a medical officer? How long must the people of Nandom, Laura, Sola, Bole, Waliwali, and Gambaga remain abandoned? If we are honest, the most painful part of this crisis is not even in the doctors who do not show up. It is the way the rest of the country shrugs as if nothing serious has happened. We all move on. As if a region, I should say, collapse is not that of the entire country. As if a life lost in the Upper West region is less Ghanaian than a life lost in Accra. We have become so numb that we can no longer feel the pain of our colleague citizens. How have we become so desensitized that entire regions can be without doctors and it barely makes a news cycle? We report, touch, and go. How have we become so selfish that we think only of our own convenience while others live in such medical deserts? Fellow Ghanaians, this cannot continue. If we do not act decisively, and just with all of our problems, this crisis will spread. Because inequality, once it's normalized, becomes permanent. Access to healthcare will become a privilege, and the idea of Ghana as a single nation will fade. It will be replaced by islands of prosperity surrounded by big oceans of neglect. That is not how you build a nation. We must fix this, not tomorrow, not in the next budget. Right now, because the next person who dies while in labor, for instance, a woman, will not die in a policy document. She will die in her home, on the roadside, in the arms of the husband, in the presence of her children. The next child who dies of a treatable infection will not die in an academic paper. He will die in a real community, surrounded by real people who will carry that grief forever. The next accident victim who bleeds to death because no doctor was available will not bleed in theory. He will bleed on asphalt. This is the human cost of a failing deployment system. We must confront that right away, with courage, not with excuses. Because fellow Ghanaians, if we cannot guarantee a doctor for every one of our colleague citizens in every region, then all our talk of development and progress becomes empty rhetoric. We cannot keep boasting about GDP growth while people die from lack of basic medical care. We cannot call this country a stable democracy while these issues continue to deep. So fellow Ghanaians, this is a plea to the doctors. We understand why some of you are refusing postings to those regions. And the government must fix those. But while we understand you, you must show up and save lives. That is what your Hippocratic oath tells you. Good morning, fellow Ghanaians.